I am Dr. Ram Narayan. I am a functional neurosurgeon. Functional neurosurgery means dealing with the problems due to functions of the brain, the spinal cord and other nervous systems by surgical methods. I am sure all of us have faced a situation when we are in a meeting or we are inside in a temple or things like that, but we feel the urge to pass urine. We cannot, but for a few minutes there is a lot of discomfort in our abdomen. But imagine a patient who cannot pass his urine whenever he wants to, or imagine another patient who passes urine continuously. These are two conditions, one which is called incontinence, where the patient passes urine continuously without any control, or second is called retention, where the patient cannot pass urine when he wants. This causes multiple problems like frequent infections and even most of the patients end up as chronic renal failure patients, as the kidneys get damaged over a period of time. So these are very depressing conditions, and then socially also it's a big problem. So imagine a person who is continuously passing urine, nobody will want to go near him. He will have problems in having social acceptability. He cannot go for a job because people will refuse to sit near him because he is always has the stench of urine with him, like that. Sacral nerves are the nerves which control the urine. In fact, sacral nerves are of 5: S1, S2, S3, S4 and S5. Out of this, S2, S3 and S4 control both the bowel and the bladder. That is, they control the urine system as well as the motion system. So whenever there is a problem with the S2, S3, S4, or whenever there is a problem of control of these nerves, you have problems with controlling the urine and the motion. It is in these patients that we offer this sacral nerve stimulation. That is, we stimulate the S3 using an electrode which is put in the back, and we give them a battery in the front in the lower abdomen, and using the battery the patient can control his urine or motion just like any one of us. We actually train the patient to use the battery, or with a computer mouse like system. He can use the control the battery and control the urine just like any one of us. Just like all my other procedures, whenever a patient comes to me, I always do a trial procedure to see whether the patient will benefit from the surgery. So as I said earlier, the patients who will benefit from this surgery include patients who have incontinence, that is, people who are not able to control their urine, they are passing urine continuously without any control, or patients who have retention, that is, they are not able to pass the urine when they want, that is, the urine is retained inside the urinary bladder and does not come out when the patient wants. There is also another condition called fecal incontinence, where the motion